many of the young women I see at the clinic in their 30s have been on the pill. They've gone on the pill at 15 and don't come off until they're 34, 35 when they're starting to try for a baby. And it's very easy for them to get quite panicked about their cycles and their fertility returning. I want to tell you about some of the common questions that I get asked. One of the first questions is, I'm thinking about coming off the pill. Do I need to let it go out of my system for the next 3 months before I start trying for a baby? And the answer is no. When you first come off the pill, you should try for a baby as soon as you can, because some studies show that your fertility is better in the early months when you first come off the pill. So don't waste time letting it go out of your system. Another question I get asked is, how long will it take for my periods or my cycles to return when I come off the pill? Now, I know I've just said that for many women they can get pregnant quite quickly, but for others there are delays, and it's not unusual to have cycle disturbances for 6 to 7 months. And cycle irregularities as well. Am I more likely to have polycystic ovaries when I come off the pill? This is quite a difficult question to answer because so many women have been on the pill for 10 to 15 years, and when you've been on the pill that long, sometimes it can mask certain underlying factors that you don't know that you've got. So some women may have polycystic ovaries when they come off the pill because they might have had it anyway without realising. If I'm trying to chart my fertility following the pill, what can I expect? When you've been on the pill for such a long time, a woman isn't aware of what her natural cycles are. So it does take time to get used to charting and noticing secretions and changes like that. I think what's hard as well is that there can be delays in ovulation returning. So it can take sort of up to 7 cycles for your ovulation to return. What if I have no periods and my cycle doesn't return when I come off the pill? This is very, very difficult because month on month you're waiting for something to happen. But it is important that if your cycle doesn't return and you're not ovulating, you do need to go and see your GP, and there will be certain blood tests and medications that you may need to take to re-establish ovulation. And then the final question is, when should I come off the pill? I'm thinking of trying for a baby. And this is a difficult one as well, because for some women they'll get pregnant very quickly when they come off the pill. For others it can take longer. But if you're in your mid-30s and you're thinking about a baby, come off the pill straight away and try. Because on average it can take 8 to 12 months to conceive. A miscarriage isn't uncommon. It's really important that the minute you start thinking about having a baby, you don't put off coming off the pill.